I think, there's a lot of people that say they're against healthcare reform, and I don't know how anyone can say they're for or against healthcare reform until we know what the bill is going to look like. There are 10 more legislative votes. There are currently 5 bills. There's 3 in the House, 2 in the Senate. At the end of the day, 10 legislative votes from now, there will be 1 bill. And we've got to wait and see what it looks like before I know whether I'm going to support it or not. I can tell you that what I will not support, if you like the coverage you have today, you've got to be able to keep it, and you've always got to be able to choose your own doctor. It cannot cover illegal immigrants. There can be no federal funding of abortions, no rationing of care, and it's got to be the kind of plan that the American people want. And so, that's some of the conditions I have as we move forward in this health care reform debate. I'm a member of the House Energy and Commerce Committee and a leader of the Conservative Democrats, the Blue Dog Coalition. I couldn't have done this alone. It takes 40 Democrats to stop a bill on the House floor. It takes 7 of us to stop a bill in committee. And so, but collectively, and I ended up as chair of the Blue Dog Healthcare Task Force leading the effort on this and putting a national face on it. But because we had enough votes to stop the bill on the floor, because we had enough votes to stop the bill in committee, which we did for 10 days, we were able to slow the process down. I think it's not that the American people do not want health care reform. They want the right kind of reform, and they don't want it to be rushed. They think it's time for us to slow down, to actually have time to read the bills we're voting on, and to get out and visit with our constituents about them. And so that's why I put the brakes on health care reform. And, a month ago, everyone would have told you there would be a vote on the House floor by August 1. And now, at the earliest, the vote will come sometime in September. That gives members of Congress a chance to listen to their people back home and a chance to read the bill before they're forced to vote on it.
What about the cost of concern about deficits saying you were instrumental in cutting out a big chunk of money? There are reports that projections, if we don't do anything, the deficit will be out of control more so than if we implement this program. Do you agree that's going to apply?
Absolutely, and this is not a new position for me. I've been having my own Tea Party for the last 9 years. It took George Washington through Bill Clinton to put this country $5 trillion in debt. It took the last president, President Bush, to double that. And in fact, Medicare Part D was the largest socialized expansion of government in my entire lifetime, Medicare Part D. And it came with a $500 billion cost that was not paid for. I'm not going to support any health care reform bill that's not deficit neutral and that's not paid for.
How constructive was the dialogue with the president on this issue?
It was very constructive. I think he understood that the House bill needed to move more to the middle, and that's what we did. We protected small businesses. We ensured that if there is a government option, it will be just that, an option. It will not be forced on anybody, and it will now compete on a level playing field with private insurance companies. And then we were successful in pushing the vote to September to give members of Congress the opportunity to go home, to visit with folks, and to actually have time to read the bill. This is not your typical piece of legislation. It's very complex. It's very complicated. There are currently 5 bills, 3 in the House, 2 in the Senate. There's 10 more legislative votes before we have a final product, and that's why I'm reserving judgment on the final product. I'm going to wait and read it and see what it says.
We're sort of going to say that you agree with the president that something needs to be done, but that it's worth taking our time and kind of getting it exactly right?
Absolutely. A lot of people are worried about national health care. The reality is half the people in America already have it. It's called Medicare, Medicaid, Our Kids First, veterans, and military retiree health care. You combine those with Social Security, that consumes 40 cents out of every tax dollar today. If health care costs continue to grow at twice the rate of inflation, that's going to reach 100% by 2040. That means we would no longer have a Department of Defense or an Army. And obviously, as a nation, we cannot afford to let that happen. At the same time, the fact that health care costs are growing twice the rate of normal inflation is also having an impact on the private sector. We're already seeing employers shift more and more of the cost of health care from the employer to the employee. It's going to reach a point in the next 10 to 15 years, by conservative estimates, that neither the employer nor the employee can afford it. And so, doing nothing I don't believe is an option, but we got to do it in a common sense kind of way. We got to do it in the kind of way that allows those who have insurance today, if they like what they got, they'll be able to keep it, and they'll always be able to choose their own doctor.
You're not afraid of facing some angry protesters here today?
No, look, I did 35 town hall meetings in April. I never moved to Washington, and after the last vote each week, I'm always on the very next plane back home to Arkansas to get out among the people and to listen to them. And those 35 town hall meetings I hosted in April is one of the reasons that I put the brakes on health care reform. The American people want us to slow down. It's not that they're against health care reform, but they want us to do it right. They want us to slow down. They want us to read the bills before we vote on them. And so, you know, my public interaction is the very reason that I led the effort out of 435 members of Congress to put the brakes on health care reform, to not kill it, but to slow it down and make sure we do it in a common sense kind of way.
So how do we pay for this then? What are the options?
There is good question. I'll tell you what the American people want us to do. They want us to squeeze every ounce of savings that we possibly can out of the current system before we even consider any new revenue. We spend more money than any country in the world on health care, and yet we're ranked 19th in efficiencies. So we've got to first squeeze all the inefficiencies out of the current very broken health care system before we ask the American people to pay another dime. We know that through preventive health care, through chronic disease management, through the waste, fraud, and abuse that we all know exist in the Medicare and Medicaid programs, that alone can pay for about half the cost of health care.
How big of an issue do you think abortion will be?
Well, it's a big issue to me because I'm pro-life, and I will not support any bill that allows any federal funding for abortions, period.
What about through premiums in the public pay for it?
It's my understanding that, all I can tell you is that no federal dollars can go to pay for abortions. If there's any health care reform bill that includes federal dollars to pay for abortions, then I'll be opposed to it.